Hello guys, I am here to give you a little bit of an update as well as some information about some tips and tricks that I have learned kind of through trial and error and the hard way about helping with the pelvic floor pain and the nerve pain, the neuralgia that I was having post-surgery. So in several of my post-surgery and recovery videos, I have talked about having some lingering pelvic floor pain that I had sought pelvic floor therapy for. I was doing therapy at home. In my 2 years post-surgery video, I had shared a tool that I had bought, a pelvic wand, and talked about how even my husband was helping me with pelvic floor therapy because it was at sometimes so painful that it was really distracting and really, I would say, impacting my quality of life. So go back to those videos if you are having pelvic floor pain. It is a very common thing after pelvic floor surgery, especially if they have done any repair to your pelvic floor. I had what they called absent perineum. So the way that I understood it, basically completely reconstructed my entire pelvic floor with a whole bunch of sutures. And when I woke up, I had stitches on the outside in my entire perineum, as well as stitches on the inside. So what happens with that stitching is it creates scar tissue. Then you also get swelling and you get pressure and pinched nerves down there, specifically your pudendal nerve, which kind of runs through that whole pelvic floor area, sort of into your butt and rectum area, and then it can even run down one or both of your legs, like all the way to your toes for me sometimes. So I was getting a ton of pain, and even at the 2-year mark, the 2.5-year mark, that pain was still there. And I just was so frustrated and feeling really hopeless about, is this going to be my life now? I'm going to be looking at pelvic floor exercises every couple of days at a minimum, just to maintain like any quality of life. Because when I would do the exercises or have my husband do them and he would go in and palpate around on those knots, like you could literally feel them. It felt like a hard knot inside my pelvic floor, and he would try to massage that out. Then I would have some relief for a couple of days, but inevitably it would always come back. So what I have found through trial and error is that the workouts that I was doing were the primary problem. I've always been into fitness and working out. I wouldn't say athletic. I don't play any sports. I am not an athlete, but I, for the past probably 10 years, have been very active in working out and lifting weights. Now, I am not a CrossFitter. I do not lift heavy weights. The heaviest weights I ever lift are 15-pound ones. And since my surgery, I've been really careful about that and was primarily only using 8-pound weights. I was also being really careful not to have my weights in my hands when I was doing deep lunges, deep squats, plie squats, basically anything where my legs were spread this direction or my legs were spread this direction. Anything that was not supporting that pelvic floor, I was not holding heavy weights in my hand. I will say I got a little more lax on that as I got a little further into my recovery, and I probably started holding weights at times that maybe I shouldn't. Well, the problem with this is when you do that, you are tensing up that pelvic floor. You are causing it to tighten, causing it to spasm. You are activating those muscles. And unlike before pelvic floor surgery, when you likely needed to tighten your pelvic floor, after pelvic floor surgery, it has been surgically tightened for you and you actually need to relax it. So you don't want to be, during a squat or a deadlift or whatever you're doing, when you're lifting those weights, you don't want to be tightening that area because you're causing yourself pain. So in the last 6 weeks or so, I have switched up my workout routine. I have not been using weights. I'll talk about using some 2-pound weights here in a second, but I've not been doing workouts with weights and my pain is gone. I have not had to do any pelvic floor therapy at all in about a month, and it is gone. So that tells me that much to my dismay, because I could have fixed my own problem this whole time, it was my weights. It was the workouts I was doing. So I'm going to link down in the description box some workout routines that I think are totally safe for you to do. Now, when I say totally safe, I mean like post-recovery, not in that first 6-week period, maybe not even in the first 6 months, okay? I mean, I was essentially told by my surgeon that I shouldn't be doing any types of squats for quite some time. So you need to go easy. You do not want to do something to mess up your repairs and re-prolapse, especially if you didn't have a doctor who considers his repairs to be lifetime repairs. Then you're at an even greater risk of causing yourself damage. But if you are like me and you want to be active, you're going to be itching to get back there. So what I'm including below as far as links is a link for a woman who specializes in pelvic floor therapy and a lot of issues related to that. So her entire channel is awesome, but what I am linking is a post-surgery playlist. So she's got post-surgery gentle exercises for after hysterectomy. She's got them for after prostate surgery, but just focus on the hysterectomy and the pelvic floor ones, obviously, but they are for that like first few weeks recovery period where you just maybe want to get some stretching in. She's got some videos about if you have post-hysterectomy gas pains, which for me were terrible, like some gentle ways to relieve those without medication. So that's for in that initial few weeks. Then I am linking my favorite current workout routines, which I'm doing 2 different things. I have a treadmill and I have started doing the 12-3-30 workout. So I posted a link to a video that explains that, but essentially it is 30 minutes on the treadmill at 12 incline, which is pretty steep, trying to go at speed 3. I will say, as even like a pretty fit person, this wears me out and I sometimes have to step to the sides of the treadmill, take a quick breather. I'm talking 15 seconds and I'm back at it. But if you're getting started on it, you may need to walk at a speed of 2. You may only be able to do an incline of, I don't know, 5, 10. I'm not sure, but I will say that this workout kind of went viral, and there are a whole bunch of trainers and health experts out there saying that it is a great way to build endurance, lose fat, build muscle tone, get a nice booty, variety of things. So I'm trying to do that at least 2 days a week. And then about 3 days a week, I am doing, also linked below, svelte training videos, and they were originally created by a woman named Meredith Shirk. So that's the channel I'm taking you to, but she has other trainers who make videos with and for her. They are all no equipment, low impact, totally safe for your pelvic floor, past that 6-week surgery mark, probably see what your doctor says, maybe 12 weeks, but they are all excellent ways to use your own body as your workout equipment. Like some of the moves she has you do are really surprisingly hard and you're literally just tightening your muscles. So there's one where she has you do like a manual bicep. You're just holding your biceps really, really tight like this. But after about 10, 15 seconds, it starts to feel like you're holding 20-pound weights. So I'm not experiencing any weight gain by taking away weights. I do notice that the tone of my body's changing a little bit, not in a bad way, but when I was using weights, I was perhaps a little bit more bulky than I am now, and now I'm just very toned and slim. But I'm only about a month, 6 weeks into this, and I'm really excited to see what the results are gonna be about losing, you know, inches, pounds, whatever. I'm just wanting to get back to my ideal weight, but also I just really enjoy working out for health and sanity. And then the last link I'm providing you is to another YouTube trainer. All these videos are totally free. You do not need to go to the gym to get a good workout. You do not need to pay any subscription fees to get a good workout. Her name is Body Fit by Amy. That's the name of her channel. She has everything, like kettlebell workouts, pregnancy workouts, postnatal workouts. She doesn't have post-pelvic surgery workouts, although I have reached out to her and asked her if she wants to collab with me to come up with some ideas. Never heard back. But I'm linking a playlist of a bunch of her videos that are all no equipment. So they are body weight, and they should also be safe for you. You should always be careful with deep squats, like plie squats, where you're spreading your legs really wide. That you should never do that if that feels uncomfortable. If you feel pain down there, just stop, don't do it yet. I would say for probably the first year after my surgery, I felt quite a bit of tension when I did that. I could almost feel a heaviness. And so I kind of just tried to avoid that for quite some time. I can do them now and I don't feel much of anything. So I really just wanted to put this out there for those of you who are interested in working out, wanting to get back to that, but you're like scared. I was totally scared. And when I asked my doctor, my surgeon, for recommendations on working out, he was like, oh, you know, I mean, you don't need heavy weight to work out. But he didn't say to me what he should have, which was body weight workouts are safest. You know, he did say, like, don't spread your legs really wide with weights in your hands. So that was always a parameter for me. I can now run and jog if I want. For the first time in 15 years, I can do it without peeing myself, but running is just not my fave. Nope. But I am really enjoying this treadmill workout a couple days a week, and then doing the Meredith Shirk Svelte workouts another couple days of the week. They're little short, like 7-minute videos, typically 7 minutes of actually working out if you go through it twice like she suggests, but I'll put like 3 of those together to get somewhere between a 25 and 30-minute workout, and that's what I do. So if you have any questions about anything related to fitness or good workout programs, I do know of some others. These are just some of the ones that I think that I could recommend to you that in general should be very safe for your post-recovery. I'm not talking the first 6 weeks. Then you should stick to these Michelle Kennerly videos, which are very gentle. Yeah. So if you have any questions, let me know. Thank you again. Please hit the subscribe button, just because it's helping to get this content out to other women and make it more relevant in searches. So thank you again. Have a good day.